Can certain exercises affect your scoliosis? Exercise is important for all types of patients, and especially important for patients that actually have scoliosis. There is an assumption that, if you have scoliosis, that you should remain inactive and that you're fragile, and that if you're doing some type of exercise or some type of activity that you can hurt yourself. And there is a possibility of that being true in very small cases, but the majority of scoliosis patients can participate in activities and in exercise, and they can participate in things that they want to do. The big question is, how can exercise affect treatment outcomes? Because exercise was once questioned, like exercise can't affect scoliosis, that specific scoliosis exercises can have no effect on what's happening with scoliosis progression. One thing to understand is that movement is important. Movement is important for muscles, joints, and especially important for spine health, because the spine, especially after you're done growing, the spine only gets its nutrients through motion, meaning movement allows the discs and the ligaments and the tissues and the cerebrospinal fluid to circulate. The more you move your spine, the more nutrients circulate properly throughout the spinal tissues. So movement is very important. But the concern is, what exercises can actually help treat scoliosis? That tends to be a question. And people kind of think, well, if I do sit-ups, or if I do back exercises, or I do core exercises, or I do lat exercises, and they talk about these general type of exercises versus something that I like to call corrective exercises. General exercises really don't have an effect on the curve type or your curve size, meaning if you strengthen your abs or strengthen your back, or you're very flexible, or you do yoga, or you do Pilates, these general exercises may be good for general health and muscles and tissues, like I explained before, but in terms of affecting your curve size, they have very little effect, and this has been very, very specifically researched and studied, and I've seen it in my clinic. I've seen patients that have been, especially adult patients that have practiced yoga for 10, 15, 20 years, and they even though they stand look, their curve is still progressing, and they know their curves is worsening because it doesn't affect the curve itself. The difference is a corrective exercise, or something that we call a scoliosis-specific exercise, is an exercise that's prescribed for the specific curve type, meaning the type of curve that you have. You perform exercises that are designed to actually reduce that curve type based upon what you present with. Scoliosis exercises, specific exercises, not only also help improve core strength, they create stronger spinal muscles, they optimize support, they improve body posture and positioning, they can help brain-body coordination, they can help stimulate areas of the brain that have not been properly stimulated because of the abnormal alignment. But the most important thing is they can help actually affect the structure and curvature. And when combined with other types of therapies and bracing, they can be very effective in help managing the scoliosis. But it has to be a scoliosis-specific exercise for all those things to happen. If it's just sit-ups and push-ups and back extensions and just general type of core exercises, that's not a scoliosis-specific exercise. It's got to be one designed specifically for your scoliosis. Okay. Now, what types of exercises are safe with patients to do with scoliosis? Like, what type of exercises can they do? And, the most common thing is that we look for is definitely scoliosis-specific exercises are definitely the best. But outside of that, we're looking at things that are non-compressive, like walking, certain types of swimming, planking, yoga, Pilates, those are safe to do, meaning that those exercises are not likely to harm you, and they're good general exercises to improve fitness, health, and well-being. If we know which ones are good, then we can kind of guess which ones are bad. There will be the opposite of that. There will be things that are normally use one side of the body, and have a lot of rotation in one direction, like golf, like tennis, like bowling. These things are all used one side of the body, and it's very repetitive on one side. But really, there's no specific clear data that suggests that these exercises can cause scoliosis to progress faster. We think they can exacerbate it maybe with pain or dysfunction, but there's not a lot of clear data on one-sided sports that if they can actually cause a scoliosis to progress faster in adolescent stages. Also, exercises that deal with hyperextension. We believe that actually this is one of the worst things that enforces, especially in thoracic scoliosis, is this hyperextension of the chest can flatten the mid-back. And the more you flatten the mid-back, the more prone you are towards progression, especially in adolescence. So what are the ones that do hyperextension? Gymnastics, dance, ballet are the three most common things that can actually affect those things. Certain swim techniques can cause hyperextension and kind of like diving. Anything that you do that has this extension movement can possibly affect the progressive rates of scoliosis in an adolescent kid. What can lead to pain associated with scoliosis? And I always say it's anything that's compressive. Anything that pushes down on your spine can compress the curves and lead to pain and dysfunction. Weightlifting. Horseback riding is a really big one because you're compressing and compressing and compressing as you're riding. Long jumping, hockey, football, these things are compressive, but you also have to understand that these things have a risk of injury in patients that don't even have scoliosis. So if you have an asymmetrical spine and you're compressing it, it's more likely to cause an injury. So one thing is very clear is that every case is different. And we definitely don't think that scoliosis patients are fragile. We definitely believe they can participate in activities, they can participate in exercises, but the best type of thing to have is a scoliosis-specific exercise program based upon your curve type to provide you the best outcome. Conservative treatment means that you have less restrictions as opposed to having surgical intervention where you have rods and screws in your spine, which can actually have a greater impact on what you're doing and your restrictions over your life. If you're interested in figuring out what type of scoliosis program would be best for you in terms of exercise, reach out to us to Scoliosis Reduction Center to see if we can actually help you with your exercise program and help you manage your scoliosis conservatively using exercises, therapy, and possibly bracing. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.